Parkinson's disease, PD, or simply Parkinson's, is a neurodegenerative disease primarily of the central nervous system. Its symptoms develop gradually, with non-motor issues becoming more prevalent as the disease progresses. The motor symptoms are collectively called Parkinsonism and include masked or expressionless face, pin-rolling tremors, bradykinesia or slow movement, cogwheel rigidity, as well as postural instability, i.e., difficulty maintaining balance, causing a shuffling gait. Non-motor symptoms develop later in the disease and include behavioral changes or neuropsychiatric problems such as sleep abnormalities, psychosis, and mood swings. Cause: Parkinson's disease is due to degeneration of dopamine, producing neurons in substantia nigra, a part of midbrain. This degeneration is partly due to the amyloid aggregations of a protein, alpha-synuclein, around the neurons. Approximately 60 to 80% of dopaminergic neurons are lost before the motor signs of Parkinson's emerge. Treatment. Now, in order to understand how this deficiency is treated, we have to first look at how dopamine is normally produced in the body. Amino acid tyrosine is converted to L-dopa. L-dopa is then converted to dopamine in the presence of enzyme dopa decarboxylase. The dopamine deficiency is treated by L-dopa. It enters the bloodstream and passes through the blood-brain barrier. Reminder: the blood-brain barrier, as the name suggests, prevents most of the substances in blood, including pathogens, from entering the brain. Only specific substances are able to bypass it and enter the brain. Now, upon entering the brain, it is converted to dopamine by the enzyme dopa decarboxylase. This enzyme is present outside brain too, so theoretically it can form dopamine outside the brain too. But wait, dopamine cannot cross the blood-brain barrier. That is why we don't give dopamine in the first place. Now, to ensure that most of L-dopa enters the brain and gives dopamine in the brain, we use another drug, carbidopa. It is an antagonist, meaning it inhibits the action of an enzyme, dopa decarboxylase enzyme. But wait a minute, isn't it going to stop formation of dopamine completely? The answer is, carbidopa also cannot cross the blood-brain barrier, so it would inhibit dopa decarboxylase outside the CNS only. Now, the L-dopa can go to the brain uninterrupted and form the much-required dopamine. Along with this, symptomatic treatment is given to the patient.